My name's Dr. Greg Kowald. I work in the clinical team at Associates of Cape Cod. Patient populations are generally surviving longer, which is great for us, but they're also on a lot more immunosuppressive therapies. These are patients who may be receiving treatment for cancer, maybe organ transplant, and maybe some of the new monoclonal antibodies. This means that in general, people are immunosuppressed. We saw this a lot during the COVID-19 pandemic, where there are a lot more patients in ICU. This is where beta-glucan testing is useful. It's useful as a screen for those patients, because if those patients contract an invasive fungal disease, then that is generally high mortality, high morbidity. So being able to differentiate those patients between those you need to treat and those you can leave for now and monitor, that's a great tool for clinicians. We provide our beta-glucan test in one of two formats, either with the Fungitel assay that's been available for 20 years, or the Fungitel Stat assay that's now been on the market for around 2 to 3 years. The methods are generally similar. They're still performing a chromogenic test for beta-glucan. However, the main difference is in the format. Fungitel is more applicable to the reference laboratory, where you have lots of samples and you're able to deliver a high throughput with regular testing. Fungitel Stat is more useful for smaller and medium-sized institutions. Maybe you only have one patient sample that you need to test. Now you can do that cost effectively with a single sample in Fungitel Stat. So in the past, a lot of treatment for fungal disease has been empiric. You'd essentially present with a fever of unknown origin and weren't responding to antibacterials. That meant that there was an overuse of antifungal drugs. Now, of course, we're trying to look at antifungal drug stewardship to only use drugs with the patients that need them. To do this, we need a diagnostically driven approach. That's where diagnostics, such as beta-glucan testing, can be really useful because it differentiates those two patient groups, ones that you need to take more care and observe, and those that you can continue to monitor. Maybe you've started them on antifungal medication. As soon as you get your results, because of the high negative predictive value of beta-glucan testing, you can be fairly confident that that patient doesn't have fungal disease. That means that you can focus just on those patients that need the care and need the antifungal drugs. So in the future, we're looking for more automated solutions. We want to make beta-glucan testing as accessible to as wide an audience as possible. We're looking to provide Fungitel Stat to smaller and medium-sized institutions so they can benefit from a quick turnaround with their beta-glucan testing. That means the clinicians get the result much quicker, and that means they're able to affect patient management that much quicker as well.